new cases. 40 of those are linked to known outbreaks. 10 of those have their acquisition source under investigation by our public health team. 11 were in isolation for the entirety of their infectious period. And 34 people are in hospital. Some 9 of those are in intensive care, 7 on a ventilator. There are now, with these 50 cases, there are now 522 active cases across the state. Of these, 113 are between 0 and 9 in terms of age. 101 are between 10 and 19. And 92 are between 20 and 29. So I think that makes the point beyond any doubt that this is relevant to all age groups. And we have people in hospital from all age groups, and we have people testing positive from all age groups. So this is very much everybody's business, if that were ever in doubt. There were, very pleased to say, again, almost 50,000 test results received overnight, some 48,424, and we thank each and every one of those nearly 50,000 people. That's just a fantastic effort to come and get tested, acting on symptoms, testing when you're asked to test. Those results are critically important to us, knowing where the virus is and having the most complete picture in our fight against it. As pleasing, 29,810 Victorians were vaccinated in our state clinics yesterday. That's one of our strongest days, off the back of our strongest ever week. That's exactly what we need, more jabs in more arms and people coming forward to be vaccinated. There are, however, and I've got some significant vaccine announcements to make today, but just before I get to those, there are 41,101 vaccine appointments that are up for grabs. They don't have someone's name beside them for the balance of this week. They're in a whole range of different sites, but to give you just a few examples of where they are, 2,000 of those are at the Ford factory in Geelong. 4,600 of them are at Melton. 3,500 of those 41,000 appointments that are currently available are at Sandown. 1,600 of those are at Plenty Rangers Arts Centre in South Morang. Frankston's Bayside Centre has 1,300 of them. Shepparton, 900 appointments available there over the rest of this week, and 700 at our new drive-through in Campbellfield. That's not obviously the full 55 sites, but that's just a bit of a flavour of some of the capacity, some of the room for you to go online or to ring the number and book one of those appointments. So coronavirus.vic.gov.au or 1800 675 398. Those appointments do not have someone's name beside them right now. They are a mix, pretty much 50-50, of Pfizer and Astra. So please, if you're watching this now or listening to it, please go online, book an appointment. They're there waiting for you. But in even better news in relation to vaccinations, I'm very pleased to be able to announce that from 7 a.m. tomorrow morning, some 830,000 first dose appointments over the next 4 weeks will be opening up. So they'll be open from 7 a.m. tomorrow morning, 830,000 first dose appointments. They will all be filled, I'm sure, and that will mean we will achieve our 1 million doses over 5 weeks. In fact, I think we will exceed the 1 million doses over the 5 weeks, such is the interest across the community. In really important news, we're able today also not only to indicate that we're opening up those 830,000 first dose appointments, we're also able to announce that from tomorrow, all 16 to 39-year-olds across Victoria will be eligible for Pfizer, because we now can be confident that the Polish doses are coming to us. They will arrive, and we're able to expand that program and open up eligibility for essentially all Victorians. There's only one slight caveat on that. 16 and 17-year-olds are not eligible for Astra, so they must be Pfizer. 18 to 39, it is both. They're eligible for both now from 7 a.m. tomorrow. Previously, obviously, that age group was only eligible for AstraZeneca. You make your appointment, you turn up, you will be offered both, unless, of course, you're a 16 or 17-year-old, or in the case of someone who's 60 and older, where Astra is the preferred vaccine on medical grounds. You will be able to access either of them. There are 450,000 of the 830,000 appointments I'm announcing will open tomorrow are Pfizer appointments. So 450,000 of the 830,000 are Pfizer appointments. They will open tomorrow, and this is a really significant announcement, and I think that every time we've opened up additional age cohorts, additional age groups, we have seen really significant and strong take-up, and we've got to that sort of 50 and 60% mark really quickly. Now, I just want to caution, there are like 1.2 million people in that age group who we don't think have been vaccinated yet. There's 450,000 Pfizer shots. In total, there's 830,000 appointments open. Not everybody will be able to book an appointment tomorrow because I don't have supply for everybody. I do have supply for 450,000 Pfizer shots and 830,000 in total, both Pfizer and AstraZeneca. The long and the short of this is get online, ring the phone number tomorrow, book an appointment, and turn up when the time comes over these next 4 weeks. Play your part in that race to 80%, where lockdowns are no longer something that we need to do, where our freedoms are, we're all much more free to do the things we want to be doing. And of course we can resume our economic recovery in earnest. So this is a very significant announcement. I just ask people to be patient. There isn't at this stage enough for every single person who will want to come forward and make a booking, but if we can get these appointments out the door, if we can get these jabs into arms over the next 4 weeks, we'll achieve our target of 1 million. We'll probably do better than that, and we will be well on the way to getting to that 70% and 80% mark. Now, just for those who've already got appointments, please honour those appointments. There's nothing, I think, worse than the notion of someone who's booked in who then makes a choice to, instead of getting the jab today, they'll join a queue tomorrow. I want people to, if they can, please go and honour your appointment, turn up and get the vaccine that you have booked in for. I know this is always challenging, and there's always sort of the last day of one eligibility period and the first day of a new one. That's the nature of opening this up slowly. It's the nature also of not necessarily having every dose that we need on day one. Supply is not here to do everybody, so we've had to do this cohort-based model, and again, we're trying to make this as simple as possible, and we've now arrived at a point because we have supply, and I won't make bookings large-scale, hundreds and hundreds of thousands of bookings for stuff that we haven't got. That wouldn't make a lot of sense, but we now can with confidence offer those bookings. They'll be filled, those jabs will be administered, and we'll all be in a much stronger position. Can I thank everybody who's been vaccinated to this point? Can I thank all the staff who are doing that important work? This distribution, these 830,000 appointments, 450 and 380, Pfizer and AstraZeneca proportionally, they will be available at all 55 of our sites, 51 walk-ups and 51 walk-in and 4 drive-through. We are encouraging people to make a booking. A booking is the most important way and the only way that you can get into this system unless you are a priority worker. But we communicate with them separately. For instance, aged care, there is some priority lanes and things of that nature. But this is a very significant expansion of the program, and I look forward to seeing many people making bookings tomorrow and then turning up and honouring those appointments in the days and weeks ahead. We're putting on, just for completeness sake, there's 350 people who answer the phone at the moment. That's being increased to 500 tomorrow. But any time you are trying to fit 1.2 million into 450,000, or even into the whole cohort of 830,000 doses, you know, there will be some tension there and there'll be some pressure. I ask people to be patient. If I had supply for everybody, then everybody would be able to be booked. I don't have supply for everyone, but we do have additional supply, and we're making that available to as many people as fast as we possibly can. And that's why tomorrow from 7 a.m. those appointments will be open. I now might ask Jerome to speak to the outbreak map, as it were, to give you a bit of a sense of all those links in those chains of transmission, and then we're happy to take any and all questions you have.
Thank you, Premier, and good morning. So 51 new cases today, one of those in hotel quarantine, 50 community cases. That takes us to 522 active cases of coronavirus here in Victoria. 34 people in hospital, 9 of whom are in intensive care, and 7 of those are on a ventilator. And of course, we send our very best wishes to everybody who's recovering from coronavirus here in Victoria. Note that of the 34 people in hospital, 23 are under the age of 40, and that includes 1 infant. We now currently have 16,612 primary close contacts and 14,400 secondary close contacts. Both those numbers are up from yesterday as we continue our active work, particularly around Shepperton and in support of the Royal Melbourne Hospital and a couple of other outbreak sites. My thanks to all those close on 30,000 people, in fact over 30,000 people who are doing the hard yards of their 14-day isolation, and for the commitment they're showing to keeping us all safe. We did clear 9,500 primary close contacts in the last few days, so 9,521 primary close contacts completed over the last six or seven days. And again, that's a recognition of the older part, the more mature parts of the outbreak now winding up as we move into a number of active fronts at this point in time. In terms of the 50 new community cases today, 7 of those are associated with the Shepperton cluster. 6 are associated with the My Centre childcare centre in Broadmeadows. 12 are associated and linked to the Newport, Altona North and Wyndham outbreak area. 6 are associated with day 13 tests around the original Hobson's Bay cluster, including Altaqua. 4 are associated with the Royal Melbourne Hospital, the new outbreak we're working on there. 2 are existing primary close contacts associated with the ophthalmologist from a few weeks back around the Royal Children's Hospital. And then we have 3 known household contacts of earlier positive cases that we have linked. Of the 10 unlinked cases today, we're able to associate those pretty quickly. 4 of them are associated with the Altona North, Wyndham and Newport area and that wider community outbreak that we've been talking about. 3 are associated with the Carlton and Fitzroy North area. 2 are linked to Thomastown and 1 is linked to South Bank. In terms of the shape of the outbreak at this point in time, we have 284 of the active cases are associated with that original outbreak around Hobson's Bay, Caroline Springs, Melton, Glenroy and the major schools. We still have a number of active cases, particularly as those day 13 tests unveiled a significant number of new positives, and those cases of course continue to isolate safely. We have 2,136 primary close contacts now isolating around the original part of the outbreak, that more mature part of the outbreak that is well under control. With regard to the change of transmission running in the St Kilda area, St Kilda, Caulfield North, we have no new cases today, around 35 cases in total around that part of our outbreak. 1,852 primary close contacts identified with those outbreaks. Over 3/4 of those have returned a negative test already. And we continue to work with them to identify any further links we may need to find. We have a cluster in the CBD and Brunswick area, the inner north area, that has 25 cases within it, 2 new today, 378 primary close contacts identified. It's a quite specific set of known cases. 71% of those have returned a negative test so far, and we continue to work with them to do the remainder on that. Then we really have the 2 active fronts that we're now most focused on. The Shepperton cluster is now connected to the Royal Melbourne Hospital cluster. One of the index case for the Royal Melbourne Hospital is a patient who came from the Shepperton area who's linked with the active households that we're working with in that area. I can also confirm that Genomics has confirmed that Shepperton is connected to the Glenroy cluster. So we have a very clear genomic match, and my thanks to the outstanding work of our various specialist lab technicians in identifying that genomics work and that ongoing genomics we do around all of the cases here in Victoria. So that genomic link gives us a very good lead in terms of now finding that actual connection between the Glenroy cluster and the Shepperton cluster. We have a number of lines of inquiry, and we'll of course keep you updated as that work comes through, but it does at least remove a number of other options. In terms of Shepperton, there are now a total of 44 active cases associated with the Shepperton cluster. We now have, that's an increase of 7 on yesterday. We have 3,840 primary close contacts, many of those associated with the schools that we've been talking about. Almost half of those have returned a negative test. And can I just again thank the entire Shepperton community. We have a very firm grip on the Shepperton outbreak at this time. Some fantastic work by the school communities and the wider local leadership. Almost 3,500 tests completed yesterday in Shepperton, and that work of course continues over the coming days. With regard to the Royal Melbourne Hospital, we have a total of 14 cases associated with the RMH. Obviously a very tight set of actions in place within the RMH community. 450 staff are furloughing at this time. We're getting a very high number of tests, of course, coming through those staff. And my thanks to the entire team at the RMH and our other associated health services for their response on this most important outbreak. And then the area of most active concern at this point remains the Altona North, Newport, Wyndham area. It's quite a large scatter field now of a number of exposure sites and a number of connections between the positive cases we're identifying in that area. We currently have 68 active cases in that area. 2,700 primary close contacts have been identified. Over 1,000 of those have returned a negative test, and we continue to work with the remainder to make sure they get their testing results in and that we can continue that isolation work. I'd like to call out in particular the Woolworths at Millers Junction in Altona North. We have a large number of identified primary close contacts through our QR code system, particularly on the 16th of August and the 18th to 20th of August. So it's a very recent exposure site. If you were in that area, if you used that Woolworths, if you didn't use a QR code system, please come forward to get tested immediately and let us know. There are a number of other exposure sites in the Altona North, Newport and Wyndham areas, particularly around Millers Road. Really ask everybody to please check those exposure sites, and if you're in that area, please come forward to get tested. We're continuing the work on linking the remaining unlinked cases, the cases we do not have clear source acquisition for. They do group increasingly quite coherently, significant number in that in our western suburbs area that we're continuing to put more focus upon. We'll of course continue to work, but remember, we are still seeing positive cases in many other suburbs across Melbourne. We will do a lot more work over the coming days to track down those acquisitions, but please, we'd ask the community to be cautious and to always get tested if you have any symptoms. And then finally, with regard to vaccinations, over 394,000 vaccinations delivered last week, combining over 200,000 from our GPs. I can give a huge thanks to the Victorian GPs and pharmacies for the work they're doing on the vaccination programme. That's the largest week we've ever done last week, and of course, with the announcement the Premier's just made, we expect to see every week now setting new highs in terms of the number of people getting vaccinated in Victoria. I can confirm that anybody who is under the age of 40 who already has an AstraZeneca appointment booked, you will be offered Pfizer or AstraZeneca at your appointment. You do not need to change your appointment. Please just turn up at your appointed slot. You will have the option of taking either Pfizer or AstraZeneca. You do not need to contact us. You do not need to change your booking. As the Premier has said, from 7 o'clock tomorrow morning, the online booking system will be able to take Pfizer appointments. So if you're 16 to 39 and you want to avail yourself of the opportunity of the 450,000 Pfizer appointments, all the AstraZeneca appointments that are already there, from 7 o'clock tomorrow, you can log onto the system. If you log on today, you will only find the AstraZeneca appointments. If you log on tomorrow, you will find the new 450,000 appointments the Premier has talked about for Pfizer. Again, the call centre will be able to help you tomorrow with making bookings for those Pfizer appointments. It will not be able to help you today with those Pfizer appointments. With that, I'll hand to the Premier for questions.
I'm happy to take any questions you have.
Did you consider prioritising, say, Year 12 students to be at the front of the queue for Pfizer?
Rich will have more to say about prioritisation for our students. I just want to draw people back to some discussions that were held at National Cabinet last Friday, where we literally went around the room and everyone was asked what their intentions were in relation to 12 and up, and we made it clear that it's our intention to have at least those kids with a first dose, children and young adults with a first dose, and if we can do better than that, we will by the end of the school year. The school year and school environments provide us with a unique platform, if you like, a trusted platform. Not an easy task. It's a very significant number of jabs to get into arms, but we'll have more to say about Year 12's exams and their vaccination and the sense of priority for them, as well as some who will be involved in delivering those exams. We'll have more to say about that soon, just as soon as we can.
But is that something that, getting Year 12s back in the classroom, is that got to be top of the list?
Well, getting them through their exams is obviously the top of the list. And again, we're looking to try and get all of our students back to school as fast as we possibly can. But I'm not here today to make definitive announcements about when different student groups will get their vaccine. But the point you're making about trying to prioritise our most senior students because they've got arguably the most impactful exams coming up, absolutely we're alive to that, and we'll make some announcements soon. And it's important, not to make announcements that you can't back up. So we will make those announcements soon. We are thinking about that, actively working about it. Ministers were talking about that issue and many others as recently as last night. And as soon as we're ready to make announcements, we will.
Is it possible that there'll be Year 12s who won't see the inside of a classroom between now and when they need to sit their exams?
Well, not if everyone follows the rules, and not if we all work as hard as we can to drive these case numbers down. Like today's lesson yesterday, that's good. Problem is, I don't know what the numbers are going to be tomorrow. What I do know is that if people are compliant with these rules, as challenging, as difficult as they are, if there is just that acknowledgement that there's no other option, there just isn't. And that's why every leader in the country is signed on to this plan. That's why every leader in the country has or is using lockdowns to deal with this fundamental dilemma. Delta infects really fast. We can't vaccinate people fast enough because we haven't got the supply in order to vaccinate ahead of the infection curve, if you like. I'll just read out some numbers. The number of people who are quite young that are in hospital, the number of people who are quite young who've got this is, I think, it's very, very concerning. And if there was another way, then every premier in the country would have chosen it, including me.
You keep saying we haven't got supply. We've got a stockpile of 6 million AstraZeneca doses.
Well,
doesn't that imply that we do have supply of a perfectly good vaccine and we should be using it?
Well, I think the Prime Minister has made some comments today about my position on AstraZeneca, and I'm grateful for his acknowledgement that I have been very clear. It's not for politicians to tell you what vaccine to get. Your doctor should tell you that. And if you haven't got a GP, if you come to one of our clinics, then I have made sure that at all of those clinics there is a senior health professional who can sit with you and talk with you about which vaccine is best for you, and then you can make an informed choice. And many people have chosen Astra. Many people have followed the advice of the Chief Health Officer. The vaccine you can get today is the best vaccine. And that's why an appointment today is better than an actual appointment to get the jab today is better than a booking in 3 or 4 weeks. Not that bookings are unimportant, that's why we're opening them up tomorrow, and I think they'll go really fast. And then I'll have further announcements to make once additional stock gets here. If I had 3 million doses of Pfizer, Moderna, whatever, then I'd open those appointments up. I don't have that. AstraZeneca is a little more complicated because of some of the ATAGI advice and some of the challenges there. But that's why you're better to get your. I've always had this view. You're better to get your medical advice from a medical practitioner. Get your health advice from a health professional, not from people who are not qualified to do that. But I've been pretty keen to push this. That it is a conversation. They've been through the TGA. Like, this is the world's strongest approval process. They're both safe, but they relate differently to different people, and your circumstances have to come into that. And I didn't make these announcements about Pfizer last Thursday. That's seen quite a lot of Astra appointments cancelled. Some 15,000 appointments were cancelled yesterday. But I can't have this stuff sitting in the freezer. We need to get it out there, and I think it's only fair. If I've got Pfizer available, then people should have that choice. And then hopefully they can all make that choice based on medical advice, and they'll get the vaccine that is most appropriate for them as fast as possible, and then we all benefit from that.
You're now offering people with an Astra. Can I just go on Astra, Rich? You're now offering people with an AstraZeneca appointment the chance to get Pfizer when they
which will be a small number, not a lot of people, sadly, because those numbers we've not seen a lot of bookings since some announcements that were made last week.
I'm wondering that obviously sends and I'm not blaming you for this, it sends a negative signal about AstraZeneca. It's not really encouraging people to continue the AstraZeneca take-up. Are you now at the point where you're not interested in signals on AstraZeneca? You're making a pragmatic decision that not enough people want Astra, so you're just saying, kill Astra, move to Pfizer, let's get that out as quick as possible.
No, I'm not saying that at all. What I'm saying is that I've got, because of supply that's been provided to us or will very soon arrive, I'm going to have 450,000 doses, and the spot for them is not in the freezer while I continue to try and push Astra. It's in people's arms. And it's simply wrong to have that stockpile, which is not anywhere near. I'm just sort of checking myself using the term stockpile. I don't know that we've ever really had a stockpile, but still, we've got 450,000. I'm not going to leave them in the fridge and then kind of deny people a choice that is a very real one. There is a choice available, and I think it's only fair that people, when it's clear that there is availability of both, then they should be offered both. However, if you're in the older group, then you're recommended medically to take the AstraZeneca, not to take Pfizer. So, we're not at 100% in any age group. In fact, there's still plenty of people in their 60s and 50s that need to come forward and get either a second dose or indeed their first and second dose. So, Astra will be a continued part of our rollout. Continued part of the federal government's program, and we'll do our best to continue to be consistent. I have been completely consistent. It's not for me to tell you what vaccine to get. It's for me to make all of them available as soon as I possibly can. We're doing more than half the vaccinating in this state. That is much more than was ever countenanced when we signed up for this. But We're just getting it done. And if I've got stock that means people can have a choice, then it's only fair to give them that choice. And that's exactly what we've done.
At the same time, you're telling people who have booked an AstraZeneca appointment, who clearly had a willingness to get AstraZeneca, that they can now arrive at their appointment and get a Pfizer instead.
Yep.
At the same time, you're saying that there is limited Pfizer supply. But by making that decision, you're eating into the Pfizer supply. Don't you see those two things as incongruous?
Well, mate, if you want to blame me for the fact that we don't have enough vaccines, like really, seriously, I'm getting it into people's arms as fast as I can. I didn't do the ordering, and I don't provide the medical advice on what's safe and what isn't. That's for others. But I won't stand here and say to people, you must get Astra today when I've got Pfizer in the fridge. That wouldn't be right. That would not be right. I've also seen, 10,000 appointments cancelled a day, and like yesterday was 15,000. So there comes a point when what you'd like and what you face are sometimes different. And I didn't make those announcements last week. Others did. But I can't change that. So there is a choice available, and I would encourage people to come and get vaccinated as fast as they can. There's 830,000 appointments going online tomorrow, and we're doing the very best we can. Let just be in no doubt, this is not our program. We are helping out. We're pleased to do that. We're doing much more than we ever signed on for, and we'll do it as best we possibly can, and I'm grateful to all the staff who are doing that work. But if anyone's got a problem, anyone has got a problem with what was ordered and when, what advice was provided and when, then speak to the people who've provided that advice. Not me. We're doing the best we can in a program that is not our program. And as soon as I get supply from the Commonwealth Government, I'll stand here and I'll announce that there's even more appointments open. But let's be clear on some of those facts, I think. Rich.
Does the state support people getting a combo of vaccinations if they've already had AstraZeneca? They can now book a Pfizer.
Yeah. That's not something that there's no medical landing on that. There's no medical advice around that, so it wouldn't be for me to make that up, I'm afraid.
If all of these appointments are gobbled up, where will be all the Pfizer appointments are gobbled up? Do you know where we'll be in terms of the double dose, single dose vaccinated by the end of September? Do you have an estimate?
No, we're still on track to. I think there's a whole range of different trackers that are around the place. We want to try and. It all depends on how quickly these are gobbled up, and indeed what other supply might become available to us. And I think that the federal government have made some comments in recent times, going back to Thursday and since, that they've got irons in the fire and they're trying to get some other supply from different parts of the world. Hopefully there's some announcements that are positive in coming days that says there's even more Pfizer to get out. I don't know that that's happening, but I think there's been a few comments to that effect.
Premier, you don't have a crystal ball, but
I do not.
No, you don't. But is there any roadmap or targets of what we need to get to ease any restrictions that are currently in place?
Well, the national plan is very clear. We have 70% and 80%. They are our targets, and that's when the rules really significantly change. We have an opportunity, if we continue to drive these cases down, to have greater freedom before then. But it's all based on how many case numbers we have and the circumstances, the stories that sit behind each of those cases. Case numbers, as we've said many times, they're one indicator. If they're all tucked away in isolation, no risk to anybody, then that's less of an issue. But at the moment we have mystery cases. We have people that have spent time out in the community during their infectious period. That's why following the rules is so important. That's why getting online tomorrow morning and getting one of these vaccine appointments and turning up or honouring an appointment you've already made, really, really important. These are simple things, but they make a massive difference. And they'll give us options. Options that I'm sad to say I don't know that Sydney will necessarily have before they get to 70. We've got a chance of having some options and some choices to make between now and 70%. I can't say what they are because we don't know how many cases we're going to be dealing with. That's really in the hands of every single Victorian.
Is there any steps?
You said that New South Wales won't have options that we will, but Premier Berejiklian's already flagged that she'll be announcing some freedoms for vaccinated individuals Thursday,
she said
Friday.
One thing. There's going to be one thing.
Yeah,
that's what she said. So I'm not here to interpret what she says.
Is there any chance of moving on?
You can talk to her about that.
Is there any chance, Premier, of September 2, when there is a nominated end to this lockdown, is there any chance of eating curfews or playgrounds, or everything is through?
Yeah, everything's constantly reviewed. Everything is based on health advice. Health advice can change from time to time. I'm not guaranteeing that. I'm not promising that. It'll all be based on how many cases we have and the circumstances behind each of those cases. And again, when I say that I believe we will have options that Sydney won't have, that's not. We're not bragging or boasting. We're not critical of anyone. I think that's just a fact. So at least that's what we're working towards. Only time will tell whether in fact we do.
Has there been any discussion?
For everyone struggling to understand the Doherty modelling today, in particular what it means to... No, I'm just saying post 80%, one of the things that was mentioned was optimal infection control, essentially.
Yes.
What does that mean in Victoria in terms of contact tracing or test, trace, isolate post 80%?
Well, I think that it is not exactly clear what the Doherty modelling means by that. So if you've got thousands of cases, do the current metrics apply? So that you've got to contact cases within 24 hours of them being tested positive, you've got to contact their close contacts within 48 hours of them being notified to you, all of those metrics that work in the active suppression phase. I don't know whether they hold fast when it comes to that opening up phase when it's going to run through the unvaccinated. The key point here is that there's further work to be done, I think, and whilst there's some clarification from the Doherty today, maybe we'll have to have a further discussion. What does contact tracing look like? What does, test, trace, isolate, quarantine, TTIQ, what does that look like in a post-80% world? I don't know that that's necessarily just a continuation of what it looks like now. It might have to be different, and I don't think those questions are necessarily answered. That's not to be critical of the plan in any way. I've been very clear. We've got to get to 70 and then 80, and then we can open up. But that won't be necessarily an easy time. There will be a lot of people who'll get sick and they'll have to go to hospital, and we'll have to look after them. And there'll be some people who die during that time. That's why when you get vaccinated, you're getting vaccinated not just for yourself but for everybody else. Because the more people who are vaccinated, the less unvaccinated there are. The more manageable, the smaller the pandemic of the unvaccinated will be, the less beds will be filled by totally preventable COVID cases, the less patients for heart, stroke, whatever it might be, will be bumped out of the care that they need. Getting vaccinated for every good reason, for your family and every family, now and particularly into the future. That's why we're opening up these appointments today, and it's why we've got to keep pushing for more stock. And keep getting more jabs in arms.
Just on that, how are hospitals preparing for coming out at 70-80%?
Yeah, well, they're well briefed. They well understand the plan. But I think, let's be very clear. It'll be incredibly challenging what's going on up in Sydney at the moment to be nursing that many COVID patients, whether they're in ICU or not. Even to have 20, 30, 40 patients in hospital here in Victoria is not easy. That's what we're trying to protect against. We're trying to protect against literally thousands of patients being in our hospitals. And that'll be important always, whether we're at 80% or not. So that's why there's, back to Mark's point, there will still need to be testing, tracing, isolation and a quarantine system of some sort, even after 80%. Things like masks still may be relevant in some settings. Gathering limits may be relevant in some settings. Again, we can't really tell. But it's not like we give up on chasing this and keeping numbers low, even at 80%. We have to keep trying to suppress as much as we can, particularly for those who are not vaccinated. And the job will be easier the smaller the group of unvaccinated is. There's always some who, for medical reasons, can't get vaccinated, but what an amazing effort that'd be if we could get down to just that group, which is very low single figures. That's why I'd encourage people, for every reason, as these vaccines arrive, so the federal government provides them to us, we will get them to you. If you make an appointment, you come along, show up, honour that appointment, and we'll get this job done.
The Doherty modelling has indicated we can open up with cases circulating in the community, but not all premiers have been in agreement with this. So how do we all get on the same page nationally?
Well, I'm here to speak for Victoria's position, and we will support the national plan. But at the same time, one of the strengths of National Cabinet and our pandemic response as a nation has always been, and this has been noted many, many times inside National Cabinet and out, that every state is in a different position and every state's fight against this virus is different. If you're in a jurisdiction where they have 0 cases and have had 0 cases for a very, very long time, and they have no restrictions at all, like none, that's a different position than what we find ourselves in, and it's a wildly different position than what New South Wales is in. Where they've got significant issues in their hospital system, I'm certain. and 10,000 plus cases. So everybody's at a different place, and that means that the way in which everybody implements the plan has been different right throughout the pandemic and will continue to be different. I think that's a strength, that's not a weakness. The notion that you would pretend that everything was equal when it clearly isn't, that wouldn't be a strong plan at all.
So with regards to Victoria's plan, 50 cases today, only 11 were in isolation during their infectious period. We're starting to see more cases circulate in the community. So what does this mean for the future?
We've got to keep driving them down. We've got to keep following these rules. We've got to keep following the health advice, and we have to, all of us, acknowledge, painful as it is, that there's no other way. You don't get to have the Delta variant kind of bubble along. Oh, we can just keep it at 20 a day. No, you can't. It's 50 a day now. If we opened up tomorrow, it won't be 50. It'll be much, much higher. We just know that. And not enough people are vaccinated, and that means that many people will finish up in hospital. That's the kind of circular argument we're in at the moment, and I get it that people are not pleased. I'm not pleased to be in this position. You know, if we could send it back to Sydney where it came from, we would. But we can't do that. That isn't the way this works. We all have to work together. We've all got to find a way to get through this while we, as fast as possible, vaccinate everybody and get to that race to 80%. And then we've got lots of options. So and it won't include lockdowns. That's what we're working towards. It'll include being open.
What would you like to see by September the 2nd? Every Victorian has their eye on that number right now.
Yeah, sure. Well, so I'd like to see the case numbers as low as possible.
Would you put
but
a figure on it?
what I'd like and what necessarily is possible, you know, we just have to wait and see. You know, it's a matter of waiting for the health advice, and that'll be not just a picture of numbers, it will be looking at the story behind those cases. And at this stage, there are too many cases for us to open up today. There are too many cases for us to be confident that we could contain this if we eased restrictions. Otherwise, we would ease restrictions. There's no question about that. It's just a matter of, I know it's difficult, but we just have to wait and see what the days ahead bring for us in terms of case numbers and the story that sits behind them.
Is 0 cases still an achievable goal for Victoria?
Well, I think that, you know, people often see this in very binary terms. You know, 0 cases, whether 0 cases is achievable in the long term, like a medium and long term goal. So could you get to 0 and be at 0 for 3 months, 6 months? That's going to be incredibly difficult, particularly when you look at how many cases are raging up in New South Wales and the fact that there is still some movement between New South Wales and Victoria. You know, that's where I've said a few times that, you know, New South Wales kind of sets the tone for all of us. Decisions made there are, in fact, national decisions. I've made that point a few times. Cases up there, they're not just New South Wales cases, they're in fact Australian cases, you know. So can we get to 0? That is to say, can we get to a very low number and hopefully none that we're out in the community? That is still absolutely doable. Not easy, but it's doable. It'll be the maintenance of it will be just as hard though. But look, is there an opportunity to be free and open with 20, 30, 50, 100 cases a day? All the doctors tell us no. New South Wales shows you they've got 800 a day and they've got a lockdown on. You know, imagine what that number would be if they're open. So it is terribly frustrating that we can't just flick a switch and that there aren't 5 other options. If there were, we'd choose them. There aren't. If everybody was vaccinated, we wouldn't be locked down. If Delta hadn't come along and we were dealing with the enemy we were facing last year, things would be different. If, you know, if we didn't have cases here, then, you know, things would be very, very different. But again, what you want, what you desperately want, doesn't necessarily mean that it happens. You've got to face the realities, and the realities are every leader in this country, on the best of advice, is choosing the only option that is available to us, and that is to have restrictions on while we race to vaccinate 80% of the community, and hopefully even more than that. That's why there's 10,000, 11,000 appointments available right now, today. Go online today. From tomorrow morning, there's 830,000 appointments being opened up, and 450,000 of those are Pfizer. Everyone between 16 and 39 will be eligible from 7 o'clock tomorrow. That's not enough for everybody, but it's enough to make a good start. We're putting on extra staff. There'll be extra support and bandwidth and capacity with the website and everything, but there'll be a lot of people go there. So please be patient, but please go and make one of those bookings. Nothing would make me happier than to have all of those spots snapped up really quickly, and then we'll wait for the next delivery to come from Canberra, and then we'll open up more appointments and so on. So it will go, and we'll get to 70 and 80.
Premier, farmers in Gippsland say they'll have to plough their crops into the ground if the Pacific Island Worker Scheme isn't extended. Is the government intending to extend that scheme, and when can we expect an announcement?
Yeah, look, I saw some, and I'm not here to quarrel with David Littleproud. I don't know that I've ever met David Littleproud, but I'll just make a couple of points. I saw some announcements yesterday, or the day before, I think, and that's all great. So they're going to issue visas to everybody. Yes, that's a Commonwealth responsibility, issuing visas, but apparently we have to quarantine them all in some unlimited capacity quarantine facility somewhere. Like, it's fantasy. Like, we've got a deal with Tasmania, and I thank Peter Gutwein for his partnership. We're doing some stuff for him. He's doing 1,500 workers for us. But the notion that there's, unlimited capacity to quarantine people, no. This is why at National Cabinet I've said on more than one occasion, there's a whole lot of Pacific Islands that if only they had a slightly higher testing rate, they would be green countries, and we could have a bubble with them, and people could move here without having to be quarantined. They are orange because their community testing is not high enough. I've talked about, well, why don't we fly the samples back and we'll run the tests here? Why don't we go and set up testing clinics in some of these countries? Like, we've talked about all these things. This is not just about issuing visas and then handballing it to state governments who apparently are in charge of quarantine. Like, it'll always be limited by the number of quarantine spots we have. So I just say to Minister Littleproud, I don't think any Ag Minister knew about this, and if you know of some unlimited quarantine facility somewhere, please let me know about it, and we'll be sure to use it. If not, this sort of grandstanding achieves nothing. Nothing at all. They're just words.
Would you encourage local farmers then to look for local workers to do this work?
Well, I'd encourage all of us to work together and not play silly political games because they don't achieve anything. Beyond that, I reckon farmers and rural communities, regional communities have tried very hard to get locals to do some of this work, or people from Melbourne to do some of this work. There's a reason why this work is done by seasonal workforces every year.
It's cheaper?
There are many things. There are many things, Rich, that you might have a crack at me about. What we pay our seasonal workers, that is not a function of any decisions that I've made. The fact of the matter is that some work is done by seasonal labour every year. The borders are shut. We've got a way forward with some Pacific Islanders who are very, very low risk, and we're grateful to them for coming here and doing the work. I'd expect they'll pay a proper rate, a fair rate for the work that they do. But beyond that, just issuing visas to people, but they've got to be quarantined, and there isn't unlimited quarantine capacity. So there's going to be a limiting factor there. Let's instead of playing games and just standing up and doing announcements or pre-records on landline, work with your colleagues.
I know that you've...
At National Cabinet on Friday, there was no mention of this. No mention of this at all. Anyway.
Premier, I know that you last time asked as well, and I'll ask again, small businesses, particularly in our communities, have got some support from the federal government, but they really see no horizon forward. I mean, is there a plan to help them out? Because currently we're hearing stories of people with their backs up against the wall, not incapable of planning, unable to see beyond.
Yeah, sure. There's no question that there are many people doing it tough, but that's why there's been more than $7 billion worth of economic support and business support. That must be getting closer to $8 billion now, given the recent announcements we've made. We're pleased that some of those announcements in the last sort of 4 or 5 of those have been a partnership with Canberra. That's enormous amounts of support. And I get a lot of feedback from industry and from businesses that they're very grateful for that. And we don't provide it for that reason. We provide it because it's needed. Is there an unlimited amount of support? Is any support the same as having all your customers back? No. That's why we've got to drive these cases down so that we can get customers back into businesses. We can get people, back doing what they do best. And that's not being closed, it's being open. And as I said, if there were a different way, then of course we would choose that. I would just point to the fact that we are bringing back the rent relief scheme, and that's backdated to the day that we announced it. There's a whole range of steps. I note that there was some announcements very positively, lest anyone think I'm picking on the federal government. There were some very positive announcements yesterday in relation to childcare, and we thank the relevant federal minister for that. And we're all doing our best, including businesses. They are doing their absolute best, and we're providing support. Is there more we can do? Can I rule out doing more? Of course not. If we have to do more, we will.
There are businesses who received payments during lockdowns 4 and 5 who are still yet to receive anything for the current lockdown. Is that money on the way?
Well, there'll be some, I think, Rachel, that would only have become eligible on Saturday when we move to the regional lockdown. So I think even as hard as they're doing it, I'm sure they would appreciate that that was only a couple of days ago.
There are metro businesses as well.
Okay, I'm happy to chase up. Have you got any examples for me? There's a lot of it has been auto pay, and I know in my discussions with the Prime Minister, they're very, I think one of the reasons why they've been happy to be a partner and be a partner consistently is that we are getting it out there. We've provided them with a full breakdown of what's been paid, what's still to be paid, and they're very pleased with that, and that's why they keep partnering with us, I think, each week that we need to. But the vast majority of our monies have been that auto pay, no more paperwork, and I've got a lot of positive feedback from that. But there have been new elements to the program, so fresh applicants. If you've got any specific examples for me, I'm more than happy to chase them up for you. We want the money out. We want the money paid.
Is there Treasury modelling on the impact to our budget of this lockdown and potentially, if it goes for many more weeks, what that impact will be?
No, I don't have any Treasury modelling because it's not like it's a, I've got modelling on 4 different options and I can choose the best one. There are no other options. Impacts though, actual impacts will be measured by Treasury, and they'll be there in the regular reporting that the Treasury does, and the whole of government reporting we do.
Do we mandate for health workers and hospital workers to be vaccinated?
Well, we haven't done that yet across the board. If I got advice to do that, I would, but we don't see a significant issue. For instance, I'll just take you back. Why is vaccination of staff in private residential aged care been mandated? Because it's woefully low. That's why. Why wouldn't you necessarily have to do that in other settings? Because the vaccination levels are at 80+% now. If I get advice that we've got to do more, we have to do different things, then it's not just mandates. That might be one of the things, but there's other ways that we can do it. We can try and incentivise things. There's all ways of things. But like we're at about 81-82% in our aged care, Victorian aged care, and public sector aged care. But if you're not in if you're in the 18-19% who aren't vaccinated, then you're not part of the roster unless you go and get the jab, because we just can't take that risk. We're very pleased with the take-up rate of the vaccine across all of our frontline workers. Are we at 100%? No. Will we perhaps ever get to that? Maybe not. But we've done very well. We've done very well, and I'm grateful to them.
When the flu jab was mandated for healthcare workers,
yes,
COVID was mentioned as one of the reasons why. So why don't we do that now that we do have a COVID vaccine?
Well, if I get advice that says we're not getting the coverage we need to keep people safe, you need to mandate it, then we will do that, and that'll be a respectful process. We'll talk with unions, we'll talk with management, we'll talk with lots of different people, and we'll try and make the case and explain why that's important. I don't have that advice. No one's saying to me, we've got a big problem over here, you're going to have to mandate it, otherwise it's going to be unsafe. No one's saying that. In fact, quite the opposite. We're quite pleased with the take-up that we've had, and there hasn't been a need. There hasn't been a need to do that. What I'm saying, I suppose, is I can't rule that out, and part of the announcements we'll make quite soon about reporting of who has been vaccinated, part of the reason why we're going to get a clearer picture across the board is so that we can be doubly sure that we don't need to go any further.
On that reporting of...
Sorry.
Mine's on this as well.
It's just following on from Steph's question, just on frontline workers. There's been another outbreak at a prominent Melbourne hospital. It was only yesterday we were talking about hundreds of staff in isolation at the Royal Melbourne Hospital. So what can we do to, again, strengthen our medical...
Well, the first thing we have to accept is that even being vaccinated double dose doesn't mean you don't get it and you don't give it, right? It's reduced, but it's not 100%. And obviously those who work in high-risk environments, even with level 3 PPE, which is no fun to wear for a whole shift, there's still risks there. They are higher risk environments. That's why we've raced to get as many vaccinated as we can over these last months. That's why we've got very strong uptake in relation to those vaccines. And look, the easiest way and the best way to keep it out of hospitals is to drive it down in the broader Victorian community. If you've got less cases in the state, you'll have less cases in our hospitals. I can only imagine what it must be like in Sydney hospitals at the moment. We've been there. We know how hard it is. They must be getting close to sort of the similar numbers to us at our peak, if not more. That'll be incredibly difficult for nurses and for all their staff. Very, very difficult. And despite their best efforts, and I know they all take infection prevention and control very seriously, and still, it's almost certain you'll finish up with health workers getting this by virtue of the work they do. That's why we should be so grateful to them, and it's why we should all work as hard as possible to not make their job any harder. So please follow the rules, please get vaccinated, please get tested if you've got symptoms, and don't delay doing that. But the best way to keep it out of our hospitals is to drive these numbers further down across the Victorian community.
I think you've just started. Sydney, just 1 in 5 who have died have caught the virus in Sydney's hospitals, so that's quite a concerning figure. Well,
again, it just goes to show you, and this is not a criticism or a commentary on Sydney as such, the world over. If you've got COVID in the community, it'll get into your hospitals. They are where sick people go to get care. It's wildly infectious, and then you will finish up with it. Not only will staff get it, but health services will become points of transmission, and patients will get it. That's how this works, and we've seen that across the whole world. So that's not unique, but it's yet again another reason why we all have to do the right thing. We all have to accept and acknowledge that this is really hard, but there's no other option, and we've got to find it in ourselves to do the right thing and make the best choices for our families, for the people we love, for people we've never met, for our nurses, for our AMBOs, for our doctors, for the whole team across the health system who become that kind of ultimate safety net. Let's not make their job any harder. And when we make bad choices, we do make their job harder.
What is the state doing about all those furloughed staff in terms of getting backup staff in to those hospitals?
Yeah, look, what happens is you reprioritise. So, for instance, there'll be some care that might have been provided at the Royal Melbourne that won't be provided. It'll have to be deferred while we move people around and while we try and recalibrate. It's not good to have staff furloughed. It's very challenging. That's why, we work as hard as we can to try and keep it out. But it is a wildly infectious virus. It's then a even more wildly infectious variant, and with cases in the community, it's absolutely clear that makes the chances of it getting into our hospitals higher.
Is there an alternative workforce you can tap into?
Well, look, we have many thousands of staff across the board, and people should be in no doubt that it's not quite clinical, but when it comes to, say, contact tracing and stuff, we rotate people through different government departments. We try and rest people.
In terms of the actual health workers, is there an alternative workforce you can dip into?
Not an entire workforce, but we try and manage demand. We try and move people around. We try and recalibrate what services are offered at what time. Again, back to the point I made yesterday, the sickest will always get treated quickest, and we will configure our staff accordingly so that we can do that. That sometimes means if a health service comes under enormous pressure because of COVID, either through patients or furloughing of staff, then some less urgent cases may be deferred to give priority to those who can't wait. That's obviously regrettable, but there's no alternative. It's probably exacerbated, Rich, by the borders being closed. We would sometimes be able to bring some people in from other places, but that's very, very challenging at the moment.
Just on Richard's point, 400 staff, though, currently in isolation. That's a considerable chunk of the workforce to be out of action.
Yeah, it is, but let's not... The system's made up of many tens of thousands. So I'm not saying it's easy, but people need not be alarmed. We will make the necessary changes. That may mean that some people have to wait a little longer for some less urgent surgery, for instance, in that hospital. But I don't have advice that it needs to be anything more than localised at this point. So elective surgery across the board is still happening, but as I said yesterday, there will be some impacts in individual health services based on some of the challenges that they face.
As vaccinations go up in October, is there any chance of schools coming back even if we don't suppress cases?
Well, once we get to 70 and 80%, we have all sorts of options, whether it's in schools, in industry, in pubs and restaurants and cafes, in local parks, in your own home. We have all sorts of different options once we get to 70 and 80, more towards the 80 than the 70. We want to get our kids back to school as fast as we can, when it's safe to do so. And look at the number of cases currently in this outbreak that are under 10 and under 20. This is going where the vaccine isn't. That's what's happening here. And therefore, we've just got to see this through. I know it's incredibly difficult. And look, our kids are older, but we had a year 12 last year, but year 11 and year 9 this year, and I can only imagine how much more challenging it is if you're talking about small primary school age kids. I get that, I understand that, and I send a message to all of those parents. We will get the schools open as soon as we possibly can, but I will not open schools when I've got the Chief Health Officer telling me it's not safe to do so, because it'll just mean more cases and more infections. We've followed advice, as hard as that's been at times, but that's served us well compared to many other parts of the world. Now's not the time to be, creating options that really aren't there, creating options that aren't safe. They're the wrong choices to make.
Is that the incentive for parents, though, that they actually go? Is that the incentive for parents that they go and get their vaccination so that schools can open up? Possibly in October if that gets.
I wouldn't make it quite as wouldn't make the point as sharply as that. What I would say is that the more people who get vaccinated, the quicker we'll get to 70 and 80. And when we get to 70 and 80, we have options we simply don't have now. Because if we pretended today we were at 70% or 80%, and we said, right, everyone can go to everyone's house, industry can all reopen at 100%, pubs, bars, restaurants, everything's back to normal, then the hospitals will be full. And they'll be full of people who will be very unwell. And that's just a fact. And that's why, that's not some Victorian creation, that's not or something that my logic tells me and no one else. That's what all the experts tell us, and it's what every Premier, including the Prime Minister, has signed up to. But that changes when we get to 70 and 80, because then we have got the safety net of enough people vaccinated. We're not there now. And being angry about the fact that we're not there now, sadly doesn't get us there any faster.
Regional breakdown. The regional breakdown came out yesterday for vaccines from the federal government.
Yep.
Obviously, Geelong and Bendigo doing exceptionally well.
They are. Yes, they are.
And the outer suburbs of Melbourne, particularly the west and the northwest, are lagging behind a bit. Can you sort of explain why? Are we concerned or happy with any of those rates?
Yeah, well, there's a couple of points. I'm not responsible. And you don't often hear me say that because it's not the way I operate, but it's just a fact. I'm not responsible for what happens in GP clinics or in pharmacy. They're doing a good job, but if those numbers are up or down or could be more or whatever it is, that's a matter for the federal government. So I would direct you to them. On our clinics, we've got them open everywhere. We are adding some clinics in the west, the drive-through out at Melton. There's another one going out in Wyndham. We're doing everything we can to try and fill any gaps that there might be. I think if you look back a bit, logic tells me that earlier on we had a real surge of people were eligible the older they were. These are growth corridor areas often, not exclusively, but often. So logic tells me that perhaps there's many more younger families there. That just goes to show the announcements I've just made. Pfizer, 16 to 39, 830,000 appointments, 450,000 of which are Pfizer. Open from 7 a.m. tomorrow. That'll be great news, I think, for the outer suburbs, for young families. Go, get vaccinated. I wish I had more so that you could all get done this week and next week. It'll take a little longer than that, but as soon as we get more stock, we'll have more appointments, more announcements, and more people coming forward.
But you talk it up more so to demographics than accessibility or motivation?
Oh, it's probably a little bit of both, to be honest. Well, sorry, a little bit of all three. There will always be challenges in running something, running out a product, whatever that product might be, or offering a service across the board. There'll always be some areas that are higher and some areas that are lower. And sometimes we can explain. Can you explain to me why Bendigo and Geelong are so much higher? Like they're doing a great job. Do we absolutely understand that to the last case? I don't know. But we're looking at what they're doing and seeing whether there's any lessons there. And we'll play our part working as hard as we can to get the numbers up, not just in one part of Melbourne, but across the board. But at this stage, I don't have anyone coming to me saying, look, we've got a massive problem in suburb Y or corridor X. Please do something radically different. I don't have that advice. But I think this announcement we've made today, and now that the system's a bit simpler, 16 to 59 are now Pfizer eligible from 7 a.m. tomorrow. Hopefully some of that simplicity helps a little bit and we start to see more and more people coming forward. If we have a part of the city or state that is underdone, then we will look at all sorts of different things we can do to try and get those numbers up. We'll be in a position to be clearer about that when supply is no longer a limiting factor, and that's still some time away. Does that make sense? Good, I got the thumbs up just for the benefit of the camera.
Just to let you know, the website's crashed already with overwhelming demand.
Yep, and I don't know that you can build a website big enough for 1.2 million people who desperately want to get vaccinated. That is, look, we're never happy to see systems overwhelmed, but that speaks directly to the point that Mark's just made and a few of us have made. I think people want to get vaccinated really, really fast. I don't have enough vaccine for everyone who wants to get vaccinated over the next 4 weeks, but we do have 830,000 appointments. I just again acknowledge there's 40-odd thousand appointments, 50-odd thousand appointments available today for the coming week. The appointments I've announced do not become available until 7 a.m. tomorrow. But as I said, we're putting 150 extra call takers on to 500 people. That's a lot. It's an awful lot. Websites can have as much redundancy built into them as possible, but if literally 1 million people want to get through at one time, it's tough.
Of those 50,000 though that are available right now, if 25,000 are AstraZeneca, and 25,000 people that are younger book AstraZeneca appointments this week, knowing that when they get there they'll say, "No, can I have the Pfizer one?" Do we have an issue?
No, I think we've got a little bit of leeway there, and that's why Jerome's made it clear that if you've booked an Astra appointment and you're in that age group, perhaps even late this afternoon, then you'll be offered. As I understand it, you'll be offered both. And some will stick with Astra. That's correct, isn't it, Jerome? Yes.
We've definitely open at 7 a.m. We've got people at home trying to book that are being told that it's 8 a.m. that bookings will open.
7 a.m. is what we are announcing.
Okay.
And I'm not aware of them being told that, but it'll be 7 a.m. It's 7 a.m.
That's what they're being told on the website. I think you may have hinted on this before, but will healthcare workers be forced to declare to their employees whether or not they're vaccinated?
Well, we're going to get as much information as we possibly can, and I'll have further announcements to make about that soon. And when I do, I can take you through all the details of that. If not me, then the Health Minister will make those announcements. But, in order to be doubly sure that we've got as many people vaccinated as possible to minimise risk and to be providing safe services, then we have to double check that, and finding out who's been vaccinated and who hasn't is incredibly important. We have some of that data now, but to really make that complete and uniform, we'll have some further announcements to make about that soon.
What levers do you still have for those people, and I think Jerome's alluded to this, that some people aren't isolating properly? What levers do you still have to try and crack down on those people doing the wrong thing?
Well, we look at, I think, particularly in those sort of examples, we look at the individual circumstances of the people involved, and we try and find what will best motivate them to do the right thing. Look, if you're asked to isolate, you have to isolate. The vast majority of people are. Let's not detract from that. There will be from time to time some people who don't. The vast majority of people, I think, probably do come forward and get tested when they've got symptoms. Or sorry, put it the other way. The vast majority of those nearly 50,000 test results we got overnight were people who acted really fast. There'll be some people who went and got a test after really waiting 2 or 3 days. That's why we keep asking people, get tested quickly. The rules are there to drive case numbers down and get us open. The rules are there to save lives and to make sure our hospitals don't get overwhelmed. The rules are there so that our nurses have got a fair fight, that they can actually achieve what they work to do, and that is to care for people and save lives. And if we don't follow them, I was asked a question the other day. Well, what are the other? Are there 5 other things you can do? Are there 10 other things you can do? The answer is no. Following these rules is what will drive case numbers down, not 5 or 10 other rules. Following these rules, everyone making good choices, as hard as it is, that's what will drive these numbers down.
Just on the extent of the rollout, will you, essential workers that are, say, teenagers, 15-year-olds working in fast food or particularly in supermarkets, will you make them eligible as a sort of essential worker bracket?
In terms of to Pfizer or to any vaccine? Well, when I'm but sadly I don't have supply to do that now. And when we're ready to, we want to see as many people vaccinated. And I think we've all demonstrated that there's a risk profile issue here. So we've tried to do those that are at greatest risk of significant disease. The shift now, I think, it now shifts focus to those who are at most significant risk of transmitting this. That's the other reason why, getting as many 16 to 39-year-olds vaccinated as possible is really important, and that's why we've opened up these appointments today, to make it as simple as possible. Plus the stock arrived. When more stock arrives, we'll be able to do some of that.
If you're talking about the risk of transmission, 15-year-olds working in Woolies or other supermarkets,
the most active people,
Should they be pushed into this category as essential workers?
Well, at some point they will be, I think, Rich. At some point.
Prioritised.
So I couldn't hear the last bit.
But shouldn't they be prioritised if you're talking about risk of transmission?
Well, at some point I think they will be, is the point I'm making. There isn't sufficient supply. And if what you're saying to me, should every 14 or 15, or every 15-year-old, 16-year-old who's working in the food industry, should they be prioritised ahead of everybody else in the 16 to 39 age group? No. And by the way, I probably don't have enough vaccine to do that anyway. So let's get as many people through the program as possible. Let's try and make it as simple as we can. Some parts of it aren't simple and probably won't be able to be made simple. But I had exactly the same... I should have had a better answer, really, because I had the same question from my 16-year-old daughter today, who works in one of the jobs that you're talking about. She's 16. She's actually, in fact, 17 now. So anyway, we will have many more priority announcements to make once we have additional supply.
The case I mentioned to you yesterday, the Vietnam veteran that lives in Marumula, his family hasn't heard anything from government. Do you have an update?
I have an update in that I can say to you that this has been referred off to the exemptions team. I'm not certain whether they have resolved it one way or the other, but the process, as I indicated yesterday, was I wanted them to have a look at it and make sure that they hadn't missed anything, that they had looked at every single part of this, very, very, very compelling story. And we send our best wishes to the individual involved, and we thank him for his service, and we wish him the best at what must be a really challenging time. It's heartbreaking to have to say no to so many people, but that's the advice we have. But I am getting it rechecked. That hasn't happened yet, but it will happen as soon as it possibly can.
So they can expect a response either way?
Yes, I'm more than happy to make sure that they know whether the decision stands or whether there's a different decision. In the meantime, the team are going and checking and double checking that they haven't missed anything, just to make sure it's been looked at properly. I'm almost certain it has been, but I think everybody's entitled to that.
Can I just ask? Yeah.
Absolutely, you can. You could have gone to him half an hour ago if you wanted to.
I tried to.
Did you try to? The record will show that you tried to. Very good, Jerome.
Jerome, you mentioned that all the 10 mystery cases were linked. Is that just to broad areas, or are they epidemiologically linked?
No, so we're still doing the epidemiological link into the 10 cases that we had this morning. We can see already that they are clearly, there's some clear linkages or broad linkages we're already seeing, particularly into those hotspot areas, particularly that Newport, Altona West, Wyndham area, another little cluster around North Fitzroy and Carlton. So we're pretty confident that we'll run them down in the next day or two. So
do you mean it's clear that they're probably linked to groups, and you just need to figure out the individuals?
That's right. Look, and I think what we're seeing here now is that we have, the reason I went through the whole kind of the cluster map again today is that we've got really good fidelity and control over the vast majority of the cases that we're seeing in the state at the moment. We do have chains of transmission that are rumbling around in Altona North, in Wyndham, in Newport that we are genuinely concerned about. And we've got some stuff that's grumbling around the CBD and the Fitzroy North area, and we continue to also be concerned around the wider St Kilda area. That does not mean that every other part of the city needs to be aware that there are cases, and they might be linked to other parts of the city, but there are cases across Melbourne that we all should be aware of. So, to the questions that the Premier addressed earlier, we absolutely, between us, can get this back on the ground. We absolutely, between us, can get these cases down again over the days or weeks ahead. But it's going to require all of us, both our contact tracers, but also the wider community, to do their part.
Roughly how many cases do we still have in the outbreak that are still genuine mysteries? Because I think we had, between Saturday and yesterday, we had 43 mystery cases. Obviously, we've solved some of today's, but where are we at?
So I can give you probably a fuller update on that tomorrow or Thursday, Rachel. But I mean, I think at the moment we're looking at about, it's about 30 odd cases that are still, we're really looking forward to what those acquisition sources are. Now, bear in mind, our epidemiologists have a very high bar about what they regard as a linked case, so they really want to be very clear about what the actual acquisition source was, and that's the work we're doing. I mean, to the earlier questions around, is it disappointing to see so few cases in isolation? Those 11 isolated cases are all to the earlier mature parts of the outbreak. That's the piece that's been well controlled. We're now, we've seen over the last few days this action in the Shepparton area. So all the cases coming out of Shepparton will be new cases. They will not have been quarantining for the full infectious period. We see that with every single outbreak. Same with the RMH cases. They will all be new cases that we're pulling up now, and we've still got that active front and Altona North we need to get on top of. So there's work for us all to do, but I'm encouraged by the fantastic response of the Shepparton community and a great work by the Golden Valley Health team. Really aggressive response in place for RMH. More work to do in some other parts of the city.
That Millers Junction, Woolies, what was the advice change there? Because I think it went from Tier 2 to Tier 1 last night.
Yeah.
Some shoppers who checked in with the QR code were actually made aware on Sunday night.
Yeah, so look, we've looked again at that Woolies site, and it's really in the, it's almost at the epicentre of a number of those other exposure sites on the Millers Road area. As I've said before, we're increasingly concerned over the last few days that we continue to see cases bleed around in the Altona North and Newport area, and that's why we're really putting a big flag on it and saying we want to see more people come forward. So I apologise if that means that we're asking for more people to come forward to get tested. I've got at least, 2,700 people now in that area identified as primary close contacts. About half of them are tested. The other half I really want to get done over the next few days.
Do you worry about that gap, though, between some people being alerted Sunday night and then, going on the website?
Oh, no, well again, I think we've been talking about that area for quite a few days now, really over the weekend and the last couple of days. We'll continue to do that. So, very clear call out yesterday. We're continuing that call out today. There's a huge amount of work being done by some fantastic people, community leaders in that wider area, to really just encourage people to listen up, to pay attention to what's going on, because we've got 68 cases in that area. That is completely containable. It's completely manageable. Under 3,000 primary close contacts, we can absolutely get this back under control in the western suburbs, but we have to do it now.
What about this spike in cases in the Shepparton community? I mean, Goulburn Health is obviously asking for people to come forward and get tested.
Yep.
We've seen a bit of a jump overnight, so do you foresee that?
No, not really. I think that's the natural pattern I think you expect to see with the Shepparton outbreak. We've got 4 significant schools involved in that outbreak. All the cases in Shepparton are linked at this point in time. We can really understand those both through families and a little bit through some of the schools. Obviously a large number of exposure sites, but we're still in the opening phase of the campaign in Shepparton. Got a lot more people to test over the next 2 or 3 days, so I'd expect to see numbers continue to rise over the next few days, and then we'll see, with a significant number of people in isolation, 3,500 people in isolation now in Shepparton, that number will grow, and we'll then start to see more positive cases emerge, but there'll be people in isolation. So that will happen over the course of the next few days. The challenge for now for the Shep area is making sure we've got everybody contained and that everyone's getting tested, and that work is well underway.
So there's no evidence that it's infiltrated other parts of regional Victoria at this stage?
Oh, look, we've got...
these communities need to be...
Yeah, look, we've got exposure sites in Bendigo. We're pleased that we've not found any cases in Bendigo yet. Some really good testing results in the Bendigo area, and my thanks to the team up there for making that happen. We've got the one case in Mansfield who we believe is a pretty strong connection to the Shepparton area. Number of exposure sites in Mansfield. So, look, this is not over by any stretch of the imagination. We are still opening up what's been happening in the Shepparton area. It's positive that we've connected it into the Glenroy area. I'll be interested to find out what that actual link was, and that's the work for the next few days. But this is a moment where we need to use the time we've got now to trap the remaining active cases, get them under control, get everybody else isolating, and then we can see these numbers come down. But we're not at that stage yet.
Just on that link to Glenroy.
Glenroy to Shepparton link.
Yeah.
What does that mean? Anything for keeping the cases under control over time?
Oh, look, I mean, at this point it'll be a bit of detective work to do over the hours and days ahead around exactly then what was the linkage between Glenroy and Shepparton. So genomically, we see a very good match. So our epidemiologists, also our genomics experts, are convinced that there's a very strong linkage between those two clusters. That's why genomics are so amazing for us. We know where to look. We're exploring now a number of possible linkages between the positive cases we know about in the Glenroy area, the positive cases we know about in the Shepparton area, and those primary close contacts. So we'll work it out, we'll sift our way through it and find out where that link is.
Are there any work or family or social or cultural links between the Glenroy cluster and the Shepparton cluster that contact tracers are aware of?
That's a big question. So there's a number of lines of inquiry at the moment, Rachel. I've got nothing else to say at this point.
Are you really encouraged by the drying up of cases in St Kilda? You guys were really concerned last week about mystery cases there.
Yeah, look, I think it's always I think so. We've had a really big 4 or 5 day push in the St Kilda area. I think we've got a really good feel for support, good support from the community, particularly in St Kilda East and Caulfield North, and that little cluster we had around Fitzroy Street, Barclay Street. So we think we've got a good grip on what we know. The testing numbers were pretty solid all the way through the weekend. They're easing off now. But look, until we find all those linkages, until we're really confident we've got this, we want people to keep coming out and getting tested. What would be incredibly disappointing is that the huge amount of work that all Victorians are now doing under the lockdown, the huge amount of work that our contact tracers are doing, if in 2 weeks' time we find another crop of cases coming out because people haven't come forward to get tested. So now is the time to come out and let's pull these drains up and let's find out where these cases are. Let's wait another 2 weeks before people come forward and we have to kick the thing off again for another number of weeks.
St Vincent's Emergency Department was listed as an exposure site. I think it was listed yesterday, but for the St Vincent's Emergency Department. What was the exposure there? Was the case a patient or a staff member?
I believe it was a patient who visited St V's fairly briefly. I can give you more details on that tomorrow.
And are they linked to the Royal Melbourne?
No, not at this time.
Right. I mean, are you concerned? The 14th to yesterday was 9 days. Are you concerned that it was, an exposure a while ago in a highly sensitive setting?
No, look, I need to get the details, Rachel. I don't have the full details of the St V's exposure. We saw it a couple of days ago. We've been working with that individual case. I'm pretty sure it's an isolated case, and as we've seen with the wider response around our health services, they've been very swift to act on it.
So there's no risk of any additional cases associated to that?
No, not that we found at this point in time.
Right, okay.
Should people who actually have already been vaccinated still get tested? Is there a concern that perhaps people go, I've been vaccinated, so I don't need to go and get tested? And is that recorded in any way?
Absolutely. If you've been vaccinated, thank you. If you've been double vaccinated, that's awesome. If you've got symptoms and you've been vaccinated, get tested. The rules apply the same. Vaccination stops you getting seriously ill and stops you dying, but it doesn't stop you having COVID and it doesn't stop you passing it on. It reduces the chances of all that happening, but it's still so important. If you've got symptoms, get tested regardless of how many vaccines you've had.
Is data being kept on that? I know people do get asked if they've been vaccinated when they go and take a test.
Yeah, we're starting to.
I
mean, obviously the number of people who have been fully vaccinated is still pretty, it's a minority at this point in time, and obviously we hope to see that really change in the weeks ahead. But we track all those data pretty closely. And I can confirm only one of our patients in hospitals had one dose of AZ at this point.
Premier, the opposition are calling for a code of conduct review after you urged your senior bureaucrats to release advice on Matthew Guy's decisions as planning minister.
The opposition are completely and utterly irrelevant to the work that I do.
Is the right decision to go to constitutional convention?
And I don't know that constitutional convention's at the top of anybody's list at the moment. I think we've all got much more tangible, meaningful things. This is very real, what we're going through as a community and a economy, and for some people have got the time and luxury to write pieces about constitutional conventions, I wish them well. I haven't got time for that. I'm much more focused on getting this place open and resuming the delivery of our jobs plan and making sure that we continue to see economic growth and employment growth and that we keep people safe and well and that we're back open again. That's what's dominating me. They're the things that are they're occupying the first 50 spots on my list, not some of that other nonsense. It's just political games. Who's got time for that?
Don't those issues that Rich has just brought up in terms of how your department secretaries operate and the lines of accountability, don't they directly relate to the pandemic? The code inquiry last year found that the Westminster system had kind of failed in Victoria, and she commissioned the Victorian Public Sector Commission to look into the way departments work in Victoria. You said that there were serious issues in terms of accountability. Don't they directly relate to government?
No, they don't, Paul. That's a very, very long bow. The process last year that you've referred to is very important, and there'll be more to be said about that. The Public Sector Commissioner will report on the work that he's done, so I'm not making light of that in any way, but I think that's a very long bow. We're talking about letters that were written years ago, and I think it was pretty clear. It was pretty clear what we said at the time, and then we had an election thereafter, and we were honoured to receive the very strong support of the Victorian community. And it wasn't so much to be spending our time on those matters; it was to be spending our time delivering on the promises we made. Some people are desperately keen to hide from their record. That might be motivating these stories, I don't know. I reckon I've spent more time on this than I need to. So I've got nothing further to say on this. I've got much more important stuff to get on with. Any other questions about important things?
No, we're not due to get to 70% of vaccinations. We're not due to get to 70% of vaccinations until about
for a little
November.
bit, yep.
So if we're at 60% in October and we've still got cases, are we opening schools, or is that completely off the table?
Well, no. What I'd say is this. The Doherty modelling didn't choose 50 or 55 or 60 or 65. They chose 70 and 80 because they're the meaningful markers. That's when you've got sufficient protection that you can manage the spread of this in the unvaccinated and manage your hospital system. The easing of these rules that we're under now, that relates much more to case numbers. So, look, sadly, the Doherty modelling doesn't say that we can do a whole lot of stuff at 50 or 55 or 60. They've chosen 70 and 80 for good reason. You know, I'm a very strong supporter of the plan, and we will get to a point where lockdowns are not a feature of our life. But that is a little way off because we just don't quite have enough vaccine at the moment to get everybody through the program. But as I've said before, there is 830,000 bookings available from 7 a.m. tomorrow. And please go to the website. You'll be one of many. Please ring the phone. You'll be one of many. But please be patient and book one of those appointments.
So is it 70% or 80% or zero cases? Are they the options that we've got for schools?
Well, it's not necessarily zero cases. It's as few cases as possible out in the community posing a risk to public health. That need not be absolutely zero. We've just got to drive these numbers down. And the lower we drive them down, the more options we'll have. And we'll have our maximum options. And in fact, we will with some certainty be able to return to something very, very close to normal living when we've got 80%. And if we open at 80% with very few cases, then our nurses have got a fair fight. If you open at 80% vaccination with the hospitals already full of COVID patients, that's very challenging, that's very tough, very, very tough. So that's why we've got to keep these numbers low now and drive them down further. And the best and most meaningful thing that every Victorian can do toward that end is to get tested when you've got symptoms, book a vaccination appointment, because there's 830,000 of them available from 7 a.m. tomorrow, and please follow these rules. As hard as they are, they're the only option we have. Any other issues?
One more from me. Okay.
One more for you.
The website's still working. So the website is up and running. Call centre is working.
Sorry, one more from Jerome, not from you to Jerome. Jerome informs us, so the website is going. Look, any website, no matter how big, no matter what sort of grunt it's got behind it, if 1 million people try and log onto it at the one time, it'll face some challenges. Same as the phones. We've got 500 people from tomorrow morning, up from 350. Does that mean people will get every answer they want within 5 seconds? No. People understand that. So there's more resources. Please be patient. I wish I was here announcing that there's 4.5 million Pfizer doses. There aren't. There are 450,000. But please go on and book. This has just become, from 7 a.m, a much simpler system. And hopefully that drives even more traffic to our hubs and to GPs and to pharmacies. And we continue our race to 70% and 80%. If there's nothing else, thank you all very much.